Today we will discuss about a frequently questioned area in your exam, that is abdominal pain differential. So what are the main differential diagnoses for abdominal pain? Keep in mind that abdominal pain differentials differ according to the site of pain, onset and various characteristics. So you have learned this throughout your medical school and after that, and now this is like a final touch to further enhance or further intensify your knowledge about abdominal pain differential. So what are the main differentials you come to think of? It can be acute pancreatitis, or it can be a peptic ulcer or peptic ulcer disease. And of course, biliary colic is a very common differential. Acute cholecystitis, ascending cholangitis, acute appendicitis, renal colic, acute pyelonephritis, and also can be ectopic pregnancy. And it can be either ovarian torsion, bowel obstruction or intestinal obstruction, pelvic inflammatory disease, abdominal aortic aneurysm rupture, mesenteric ischemia, or else it can be diabetic urolitis. So this is not just a traditional video. Here my main target is to make this as a guide for your last minute reading for your exam, whether it be PLAB or USMLE or any other exams you face. So rather than describing under each condition, we'll discuss like case scenarios, so it will retain in your memory for a longer time. Acute pancreatitis is the acute inflammation of the pancreas. So as you know, pancreas is a retroperitoneal organ. Therefore, usually you get a tender epigastrium and the pain is radiating to the back. And since there is inflammation, it is associated with fever and vomiting. Usually the patients bend forward because it provides a temporary relief for them. So if a case scenario is provided, for example, a newly diagnosed patient with diabetes mellitus who is an alcoholic presenting with these features, this is a case scenario of acute pancreatitis. And there are many etiologies, and the main factors include gallstones and alcohol. So if a patient presents with reflux symptoms and with melena, that can be a case of peptic ulcer disease. So it's a clear and simple differential, I think. Okay, now can you guess this? A patient comes with a right upper quadrant pain with radiation to the scapula, and the patient has a history of gallstones and there is no fever. So what can it be? It is biliary colic. Acute cholecystitis is another very common condition we can find. It is the inflammation of gallbladder, mainly due to impaction of gallstones in cystic duct, and it is obstructing the bile. In physical examination, you can elicit the Murphy's sign, where you ask the patient to hold breath in inspiration and you palpate the abdomen, and when the gallbladder hits your hand, it creates a deep pain for the patient. And since it is inflammatory process, usually present with fever and vomit, and WBC counts are normally raised. So you can think this as a biliary colic but with fever. So what is the condition that gives you Charcot's triad? Charcot's triad is fever, jaundice and right upper quadrant pain. Yes, it's the none other than ascending cholangitis or inflammation of the bile duct. So if a patient is coming with generalized pain prior to localizing to right lower quadrant or right iliac fossa and with a rebound tenderness and with fever, this is a definitive case of acute appendicitis. So I'm not going to explain much about the condition because this is a revision guide. So my aim is to give you a final touch for your exam. If a patient presents with severe lower groin pain with hematuria and with a history of previous renal stones, this is a case of renal colic. Okay, what this can be? Patient is having urinary symptoms such as dysuria, increased frequency, urgency, and there's a unilateral loin pain with fever and dry gauze. So when it gives you the clue of fever, implies that there is an inflammatory process is going on. So it can be acute pyelonephritis. In this case scenario, a patient is having right iliac fossa or left iliac fossa pain which radiates to shoulders, and in a female patient who had her last menstrual period more than 6 weeks ago and with positive beta HCG. So when it says the positive beta HCG, we can think it's a case of ectopic pregnancy. Now in this scenario, a patient is having severe pain at right iliac fossa or left iliac fossa with a history of an ovarian cyst seen on ultrasound previously. In a female patient, it implies us it's a case of ovarian torsion. So it is very useful when you remember the signs and symptoms rather than memorizing and by hiding under each category, because it gives you a logical sensation of the condition. What is this condition? Adnexial tenderness, cervical excitation, fever, often a young female with history of sexually transmitted infection. So if the fever is going on, as I mentioned previously, there is an inflammatory process. So this can be a case of pelvic inflammatory disease. This is a clear diagnosis. Patient presenting with constipation, vomiting, abdominal distension and not passing flatus. And it implies us this is a case of bowel obstruction or intestinal obstruction. Severe pain at the abdomen or back, especially elderly gentleman who is hypertensive. So this elderly gentleman, this part is very important because it signals us that it can be a case of abdominal aortic aneurysm. Okay, now can you guess what is this? Patient is presenting with sudden onset of abdominal pain, who is systemically unwell, vomiting, and there is a history of atrial fibrillation or history of hypotension secondary to myocardial ischemia. So it signals us there is an ischemic process is going on. And with abdominal pain and vomiting, it can be a case of mesenteric ischemia. Okay, this is a good case scenario. Age is usually 50 to 70 years and left iliac fossa pain, nausea, vomiting, fever, diarrhea or constipation, both can be there, and blood mixed with your stool and raised white cell count. So if there is fever and raised white cell count, blood mixed with your stools, it signals us that an inflammatory process is associated with bowels. So we can think it's a case of diverticulitis. So these are the main differentials for abdominal pain which are frequently questioned in exams like PLAB. So this is not a explanatory video which describes the pathophysiology of each and every condition. Rather, this is a revision guide which we ran quickly through each and every condition, and please do keep in mind that this is targeting your PLAB exam and other exams, your final year medical exams, etc. So use this as a revision guide to polish and replenish your knowledge. Thank you very much. Please like and share with your friends and don't forget to subscribe. Thank you.